We're on the precipice of Black Maternal Health Week, and there is no better way to learn about it than from the people working to improve the Black maternal mortality rate. Black women are 3 times more likely to die from childbirth than white patients. And joining us now is Dr. Dawnette Lewis, an OBGYN and the director of Northwell Health Center for Maternal Health, and a Northwell Moms navigated patient, Nneka Walker, along with her son, Nico. Thank you all so much for joining us tonight. Dr. Lewis, let's start with you. Tell us a little bit about Northwell Health's Maternal Outcomes Navigation Program and how it's providing one-of-a-kind intervention for pregnant mothers.
Sure. Thank you for having me. So the navigation program started during COVID when patients were being discharged early from the hospital after having deliveries. So after vaginal deliveries, mom would be in the hospital for 24 to 48 hours. But during COVID, they would be discharged home within minutes or hours after delivery. And if you have a cesarean delivery, you're normally in the hospital for 3 to 4 days. But during COVID, it was 1 to 2 days. And so we wanted to know how those patients did when they were discharged home from the hospital. And we reached out to the folks at Health Solutions, which is Northwell's care navigation program. And they managed the discharge for complicated patients from the hospital and initially navigated postpartum patients. We've navigated 6,500 patients. And we have a multidisciplinary force within the Moms Navigation Program that include nurse practitioners, RNs, and they provide skilled coordinated care for patients who are high risk during the pregnancy and in the postpartum period.
Okay, and Nneka, you were a high-risk postpartum patient because you had preeclampsia during pregnancy. How were you able to navigate this program and describe the impact that it had on your life?
It was a really good program because I was given a nurse practitioner to come home to. So she gave me information that if I had signs and symptoms of a blood clot, which I had, to go to the hospital. And I went to the hospital, and that's why I'm here today.
And doctor, what type of health issues do you often see within your patients in the program?
So within the Moms Navigation Program, the number one reason why moms need help is because of hypertensive disorders. The second highest is due to behavioral health needs, followed by diabetes, and then followed by the fourth complication that Nakia had, which is venous thrombosis or blood clots in the leg.
And Nneka, what's some of the important information that you learned about your health pre and post pregnancy, pre and post Nico?
So I did not think about the risk of preeclampsia. Now I think about the risk of preeclampsia. And now, after you can get eclampsia, which is still high blood pressure. And then the blood clot, again, which I had. And it really helped being in that program, looking at, the signs and symptoms of what I had. And I just went straight to the hospital, and it's because of this program.
And doctor, there's, of course, more awareness and conversation surrounding disproportionately high Black maternal mortality rates these days. But what would you say are better ways that we can improve this alarming problem?
I think it comes down to education. And as much as we feel that we're talking about signs and symptoms and risk factors, I think people are still, not knowledgeable. And I think it's up to us to educate the population. So I think that's really what it boils down to, is just educating pregnant moms about complications and risk factors for the pregnancies.
Well, we can start certainly by having conversations like these. Dr. Dawnette Lewis, Nneka Walker. Nico, we thank you all so much for joining us tonight. Black Maternal Health Week is April 11th through April 17th.